Okay, hello. So I'm looking at the drug overdose data from Connecticut for the years 2012 to 2016. And we're going to look at how we can use the information about drug overdose patterns to find communities that could be best targeted for outreach programs about awareness and other kinds of prevention programs. So why is this important? Overdose deaths are steadily on the rise from 2012 to 2016. The latest data I had was for July of 2016. They've gone from about 82 per quarter to 248 at the last point of my data. It's about more than 3 times as much, more than 200% increase. So what can be done to help curb this rising, very heavily rising tide of drug overdoses? So we need to know who are the people that are being affected by this, where are they, what kind of drugs are they using, and with this information then we can build a program of information and awareness that is the most efficient in reaching populations who need it. So first we want to know who are the people behind the numbers. Who do we need to target? Who will best benefit from this kind of information? So first we can see that males make up by far the majority of overdose victims. While they began in 2012 as about twice as many or twice as often the victims of overdoses as women, they're now more than almost 4 times as many. So we've gone from twice as many to 4 times as many men are very much the most common victims here. So as we're building our image of an at-risk community, we need to ensure that men are the ones that are targeted and that messages are phrased in a way to appeal to men and bring them into gaining information. Next up, we will look at the race of the people, a race of who's most common in overdoses. So as you can see in the chart, the majority of overdosing in Connecticut victims are white from the intervals that we're looking at. They make up about 75% of the overdose deaths at the end of 2016, and whites make up about 80% of the population of Connecticut based on the 2010 census information, which was, again, the latest information that I had access to. In this chart, Hispanic and African Americans are 15.7, about 16, and about 12% of the population, respectively. Again, that's from the 2010 census. And the overdose rates for Hispanic were 12.5% and about 11% for African Americans. So their overdose rates really match really well with their percentage. In the chart here, I've combined various kinds of Asian. There were a lot of specific Asians plus Pacific Islander plus other or none listed as well for race, and those have been combined into the other category. So that's why we don't have quite 100% in the percentages of who is what, who is which drug overdose group. So as we're working on building our population, we can see that we can apply the same information, or everybody can benefit from the information pretty equally. There's not one group that is suffering disproportionately from drug overdoses in Connecticut during this time. So our next attribute that we want to look at is age. And so this chart's a little bit overwhelming to look at, but we can see really easily that there's a bimodal pattern here in the ages. So there's a spike at the late 20s and a spike in the late 40s. So between 26 and 29, and the late 40s into the early 50s, about 47 to 51. So now we know too, what sort of age group do we want to target people? Do we want to focus with college students, high schoolers? Where are we looking here? So now we can say, okay, we need to look at men in their late 20s and their late 40s. So, and again, we're not looking at any of the causes that we're trying to find here, just trying to see what sort of group could most benefit from an outreach program or an awareness program. So now we've gotten to where we have a male population, largely white, but in proportion with the population of Connecticut, and in two groups. So we need to make sure that we have information that is approachable and is interesting for people both in their late 20s and their late 40s. So this could require making two very different kinds of approaches to best reach people in these two different age brackets. So now that we have the sex, age, race of the most common overdose victims, where should we look for them? What areas of the population could benefit most from community action? So you can see in the map here that East Hartford has by far the highest rate of overdoses at 43. This is just a total too. So they had 43, and then the next highest was Naugatuck, which is only 20. So Hartford is by far the most common, the worst hit by this surge of overdoses. Has more than twice as much as the next hardest hit. So we can say, okay, we're going to try and focus a lot of energy into the East Hartford area, putting out a lot of information, and then the next place where we'd try to put energy into outreach programs would be into Naugatuck, because they're the next most common one. And the rest of the cities in the map here have, I think the next highest one has I believe 8. So Naugatuck and East Hartford are definitely big outliers that we can look at or that can be targeted. So now that we have our age, so 26 to late 20s and late 40s, race, gender, and location of our victims, what sort of information can we provide for them? So what sort of information would be useful to these people that could benefit them and raise the awareness? You give them awareness about information that is actually helpful in preventing further drug overdoses. So what drugs are they using? The majority of the drugs found in the systems of overdose victims are opioids. So these are pain medications. They're things that are derived from opium, so from the same concept as opium. These include things like codeine, morphine, lots of prescription painkillers, and heroin and fentanyl are going to be the two most prevalent ones here. And fentanyl especially is going to be something that we're going to talk about later in the presentation. And then also found in high quantities were cocaine and alcohol. So these are all the drugs that are found or that are noted as being found in the systems of overdose victims. These are the 4 that I'm going to focus on the most here: heroin, fentanyl, cocaine, and alcohol. So of all the drugs, or all of the victims, these 4 were found in 87% of the overdose victims as heroin, fentanyl, cocaine, and alcohol. And of all of the people, fentanyl and heroin were found in 57% of the victims. So now we know these are the ones that are definitely the strong, or that need the most information put out about, that are most popular, the most preferred, if that's the correct phrasing to use when talking about drugs. But these numbers don't quite tell the whole story. The way that they mark what kind of drugs were in the system of an overdose victim is just a list of everything that was in them. Everything that they found during an autopsy. So people can have multiple drugs, they can have a single one. So we still need a little bit more information about how people are using these drugs in order to really know what kind of outreach program and what kind of information could best benefit drug users or potential drug users or people who are trying to help other people not overdose in Connecticut. So one important thing here is, what is fentanyl? I know most people, I think, no heroin, cocaine, alcohol. These are all things everybody has heard of, but fentanyl is a little bit newer on the illicit drug scene. It's been around actually since the 60s, and it's a pain medication used to treat chronic pain and pain related to cancer treatments or palliative care. And it comes in a lot of different varieties. So it can be administered through dermal patches, nasal sprays, pills, injections. Some methods are things like lollipops filled with fentanyl, or ice cubes, or an under the tongue patch, like a breath patch that is actually fentanyl. In these ways, they help to release the fentanyl much slower and over time, because it has a pretty short span that the effects of it last. So while it has a very fast onset, its effects only last about 2 hours at the most. So things like patches and slow release forms help to draw out the pain relief time for patients who are using it properly or by prescription. And one of the main things about it is that it's in fact 50 to 100 times as powerful as morphine. So this is, again, part of why doctors want to drag out the administration of it, because if a patient is getting a big dose at once, it's not going to end well. And some of the side effects from it are the same as other opioids, depressed respiration and low blood pressure, particularly. And these are the effects of the drug that mostly cause deaths and overdose. The other thing about fentanyl is that it's sort of the tonic water of drug dealers. It can be powdered from any of the administration methods that I mentioned earlier. The fentanyl can be extracted and powdered and then mixed with other drugs. So it can be used as a way to cut other opioids like heroin. It can also be mixed with cocaine, either to decrease the drug dealer's cost, or to give the user kind of a bigger bang for their buck. And it doesn't end well. There was actually recently one of the first cases in, I believe, Maryland or Massachusetts, where a drug dealer was charged with manslaughter because he was cutting the drugs he was selling with fentanyl, and one of his clients died of an overdose because of the dealer mixing fentanyl with the other drugs that he was selling. So it's not a good thing for users. So how are these drugs being mixed? Excuse me. So we can see that fentanyl from the early slide, that fentanyl took a big upswing. But how does that affect the way that other drugs are being used also? So we can see here that the rate of drug overdose victims that have only a single drug in their system or do not have any fentanyl in their system rapidly is decreasing, is decreasing as the presence of fentanil goes up in the market. We can also see that the frequency of victims with only fentanyl in their system is also going up. And here I've highlighted the parts that are a bit more prevalent here, so you can just compare. In 2012, it's a very low prevalence of victims with only fentanyl in their system, and the number of victims with just heroin is much higher. And then we can see throughout the 4 years, the prevalence of fentanyl in addition to another drug increases quite a bit. So what does our community engagement look like? From all of that information, what can we boil it down to find how best to reach out to possible overdose victims in order to try and stem this wave of overdose deaths? So our community is men in their late 20s. We have two groups, in their late 20s and their late 40s. We're going to try and look at all races, try and address all racial groups, but white men especially are prevalent in the population, so that's one that's going to be a big part of it. We look at the East Hartford area specifically, and then the Naugatuck area after that, a little with a slightly less intense focus. And the information, I think, should really focus, from what we've seen in the graphs about drug usage, on the perils of fentanyl, how fentanyl is affecting other drug use, the ways that it's being introduced to drug users without their knowledge often, and its dangers as either a drug of its a solo use drug or as a mixer for other drugs. So that's what I've taken from the information here, from the information about the overdose deaths and drug use in Connecticut for 4 years. And yeah, thank you for listening, and I hope you enjoyed. Bye.